We're here with Healthy St. Joseph, and today we're going to be addressing sleep hygiene. Sleep is the first thing your doctor is going to ask you about when you go to them for just about anything. The first question they'll ask is, well, how is your sleep? Because it is one of those fundamental building blocks for overall wellness. I recommend addressing your nervous system first. So sleep happens best when you're in a state of safety versus when you're in fight or flight mode. So I'm showing here a visual example to an audio file. And the health of an audio file, it happens between those two orange lines. When it goes up and over the orange lines or down and under, you're getting a lower quality in your product. And so a flared up nervous system is one that lives pretty close to those danger lines. And so in that case, little to no input can produce a negative change in your overall wellness. So it's important to actively engage your parasympathetic nervous system, which is that rest and digest mode. So now we're going to talk about pain and sleep, because if we're talking about a flared up nervous system, likely pain is the most advanced protective system of your body. So that's the first line of defense that your body employs to get you to change something. So if we're talking about acute pain, which is things like a headache, I'm going to recommend the use of pain medication before bed or topical relief. But if you're someone who struggles with chronic pain, which is pain that lasts outside of the normal healing process of an injury or through a chronic illness like fibromyalgia, you're going to want to be intentional about unlocking the drug cabinet of your brain. So our brain is equipped with opioids that it can send to help you deal with chronic pain. And the way to unlock those is through activity and hydration. Your nerves love space, blood flow, and movement. So the more you move, the more you're stretching, you're getting proprioceptive input, which is my body in space. So when you're stretching, you're saying, I exist and this is where I'm at. If you're going to use a pain medication with chronic pain, I would recommend finding one that has sustained release. They do make extra strength Tylenols that are sustained release. And then if it's really severe, I'm actually looking into starting something called low dose naltrexone at night. And so this one, you only use it at night, and it's designed to kind of turn your alarm system off. And so what naltrexone would do is it would turn off the nervous system at night so that you can fall asleep and hopefully stay asleep. And again, I haven't started that yet, but I would recommend talking to a doctor about it if your pain levels are severe. Okay, so now we're going to talk about sleep and hormones. Everyone knows about melatonin, and melatonin is a natural sleep hormone which decreases in output as you age. And so if you're finding that like all these other things are fine and you're still struggling to sleep, start using a low dose of melatonin, and if that's not enough, just kind of work your way up from there. Another one that's really great is sustained release magnesium glycinate. I get mine from a compounding pharmacy, and it's a more natural muscle relaxer. So taking that at night for someone who is a pain patient like myself it's maybe a little bit better for you than taking like a cyclobenzaprine or a formal muscle relaxer. And it is safe to take from 300 to 600 milligrams nightly. And this again will also kind of create calmness in your nervous system. Another hormone to talk about with sleep is cortisol. And I was so amazed when I was sleep training my kids to hear about cortisol when talking about children's sleep hygiene, because there's this window before bed at a certain time frame, and you have to hit the optimum calm point where that their melatonin is naturally increasing before, and if you go past that point, it goes from melatonin to cortisol. And so when you're experiencing like an epic meltdown at bedtime, it's because your kid is overtired. Or when you feel more stress right before bed, or your mind is racing right before bed, it's cortisol. It's cortisol. So you may want to try to go to sleep like 15 minutes before you normally would if you're experiencing that. You might also want to try a brain dump where you write down everything that's on your mind 15 minutes before bed, and then you just let it go and see if that improves your sleep. The other place cortisol will kind of like disrupt you is if you see a spike in cortisol right when you wake up. So for me, for example, this is what my cortisol levels actually look like. And so my cortisol is highest right when I wake up. So if I wake up in the middle of the night, like at 3 or 4 in the morning, it's harder for me to go back to sleep because I'm waking up stressed out. And so if you relate to this, it's really important to know your cortisol arc. So like, are you seeing more cortisol right before you go to bed, or are you seeing it right when you wake up? You can do this by connecting with your doctor and asking to do a cortisol panel. So if one of these two things resonates with you, is to look into adaptogens. So there's a product that I use that's called New Adapt, and after you've taken that for like 30 days, you can switch to True Adapt. And the True Adapt is like lovely. I take it in the mornings, and I'm just like, I sleep better at night having an adaptogen that helps my body adjust to the different varying levels of stress throughout the day. Okay, another important thing is to talk about sleep and screens. So here is like the sleep screen spectrum. So the reason your brain reacts to blue screens is because they mimic the outside sky during the day. Whereas orange or red screens mimic like the light of a sunset, the light of the day waning, and so your body gets ready for sleep when it sees the red lights. So the challenge I would offer is to go 15 minutes or more without screens before your optimal bedtime to help your body prepare itself for sleep. Darkness is always the best for sleep, but if you wake up with kids during the night, which I often do, it's good to have an orange or a red light or lamp that helps for those interactions, and it will keep them in a more restful state as well. So I have these Himalayan salt lamps all over the house, and those are my favorite for orange to red light. But there's lots of options out there for those. And then finally, we're going to talk about sleep and your body. So stretching before sleep can be a really great way to release the tensions of the day. So I'm going to encourage you to counteract what you've been doing all day. So if you've been working on your computer all day, you're going to want to do the opposite, which is round your shoulders back, open your arms up, lift your head up, and breathe deeply into your belly. There's all kinds of other stretches that you can do as well, and I'm sure that you could find a nightly stretching routine on YouTube. Let's talk about pillows. And pillows are available to support you. And so the type of pillow is important, and the use of contours, like if you're a pain patient. Like I have a contoured neck pillow that cradles my head and meets my shoulders so that my spine is at a neutral position. And then, are you a side sleeper? Do you sleep on your back? Those things are important when you're choosing a pillow as well. Now, something that for pain patients with back pain or lower back pain, you may want to try getting a low grade pillow that you can put under your legs. If you're sleeping on your back, and if you sleep on your side, you'd want to put that pillow between your legs. Again, we're trying to get to a neutral spine when we're sleeping so that our bodies can rest. Blankets can also meet your sensory needs. What texture is it? How heavy is it? Weighted blankets are amazing. There's so many people who are turning towards weighted blankets to help them get better sleep. Another thing to look at is compression sheets. So if you like that feeling of tightness, like a compression sheet, essentially it just wraps around your bed. And so you're tucking in like a little burrito. So it's similar to a swaddle for a baby. But those things work because they engage your autonomic regulation and allow you to rest. So trial and error with some of those techniques can be helpful. You want to be conscientious of your temperature as well, and you want to set a range that's good for optimal comfort. And it gets harder the more people you have in your house. Hydration actually helps with sleep. So if you are well hydrated, you're going to sleep better. Sleep positions. So change that can engage rest. So you changing your position throughout the night, like if you find that you're waking up uncomfortable, like add some pillows, try to get that neutral spine in every position, but don't do it to the point where you're waking yourself up to adjust your position. So you want to just like try to plan for comfort throughout the night. And what I recommend if you're really struggling with sleep is to end your sleep routines with mindfulness. And so this would be the habit of, as you're laying down, checking in with every part of your body. So it gets kind of boring, and it's supposed to be boring, so it should put you to sleep. So like lay back and you just check in on your toes. My toes. You feel your toes, you can wiggle them, or you can just flex your feet and feel those as well. And then that draws your attention to your ankles. And then you can work your way up your body and then release tension from your head and from your neck and your shoulders as much as you can by imagining it filling or filtering through you down into your pillow or down through your feet and out your toes. So that visual representation in your mind can actually be really helpful in getting you good rest.